Health and Human Services Finance Committee. They're meeting at 1 today. So I'm really excited. I think we'll definitely get noticed today because we've got a great big group. So thank you again. And oh, one more thing. I forgot to mention that a very special couple from Fairmont, Minnesota, that is Donna and John Holstein. They wanted to join us today, but they're having some mobility issues, but they're here with us in spirit. And she also wanted to give us a little something special. So they got donuts for us this morning. So I'll be we will only have like a short amount of time with the legislators, like 5-10 minutes is about all that we'll get. And so we want to just go over those talking points, and we'll introduce ourselves, of course, go over those talking points, and then I have a list of legislation that we are going to ask them if they would support that, or if they don't, or if they're a maybe, because later on we can go back to them if this legislation keeps moving forward and say, hey, you told us before that you supported this, and can we still count on your support, that kind of thing, or we know who we need to talk to more to try to persuade them to support our legislation. Okay, and so I have a sheet. I'll give it to you, Mary. I haven't gotten to you yet, and it's just a quick yes, no, maybe. But yes, I want you to keep track of that, and so your leaders will have those sheets, and they'll turn those back into me at the end. And I'm also giving your leaders a information sheets for all of you. It's like a little Save Our Hospital Lobby Day guide, and it has a map on there. So once we get to the Capitol, for those of us who have meetings in the Senate office building and the state office building right away, we'll be going to the basement of the Capitol and finding the tunnel system and using that to get over to the building. So I think it's pretty self-explanatory, but how many of you have been to the Capitol before and have used the tunnel system? How many of you have used the tunnel system before? Oh, just a few of you, okay. So I asked the first question, how many of you have been to the Capitol? Let's go back to that. Quite a few.
Let's go downstairs.
All right. There's another sign. We're still heading in the right direction.
It's a lot of walking.
I was pretty much responsible. Yes.
Oh, yeah, for sure.
Hi.
Greetings.
Hi. So, the reason you're here, you need to do something with that.
We spent $10 million already this morning. We're good.
Hi, thank you for being here today. Hello, welcome. Welcome. Thanks for taking time out of your days and from work and everything else what you do in your life to come down here and spend time with us today. I appreciate it. I'm looking forward to hearing more about the issue and what your concerns are, etc. And also could let me know where you're all from.
This is pretty much Albert Lee, folks, yeah?
Okay.
He's from Dale. You're from.
I live in Northwood, Iowa.
All right.
So now it's an interstate issue.
All right.
Yeah, and it really is, because not only does our hospital in Albert Lee serve Freeborn County, but it also serves the northern Iowa counties as well. They come up to our hospital. So, and basically I don't know if do you know anything about Save Our Hospital or what's going on?
I know nothing at all. So one of the first questions I have, knowing that some of the medical providers out there have acquired different hospitals over time, are you folks more of an independent for your own area? Is your hospital owned by a larger group that is closing down to funnel it? That's why I'm asking. So
So we were Navy Hospital, which was kind of just a local hospital, And then Mayo wanted to affiliate with us, and the people on the board thought that was a good idea at the time, with many promises of expanding services and better care. And then now they last June we found out that they are going to take our special care unit, which is our version of an ICU, and that left in October. And
Where did it go? Where's the next closest place?
Good question. So we a few years ago, I don't know exactly the date, but they consolidated us with the Austin Hospital, which is also Mayo affiliated now. So basically we're 2 campuses, 1 hospital. So then the ICU or the SCU moved in October. They were planning on moving the inpatient surgery, so that would be all surgeries where you have to have an overnight stay, over to Austin actually in January, but they postponed it, realizing that they weren't quite prepared. And that's probably supposed to happen, I think, slated for June now. And then the next thing to leave, I think, is next January, is our birthing center. And then at some point also the med surge, which is basically any overnight stays in the hospital. So basically all that will move over to Austin, which is 23 miles away. And then what we will be basically left with is an ER. And then from Austin, what they are moving is their behavioral health. So we will not really have a hospital in Albert Lea. We will have an ER and a behavioral health hospital, but not a hospital as we see it. They will still perform outpatient surgery and have an ER, and that will basically be it. We will still have our clinic, which is also Mayo. We're concerned, I-90, it's been horrible this year. I know I commute to work, I work in Adams, and so I go on 90 every day to work, and it's been pretty bad. And there are days that the ambulances have not run because the roads are so bad between us and Austin. And then to make it worse, some people say, 23 miles, that's not that far. Well, we believe it's too far, especially a woman going into labor, when they move the labor and delivery, the first time pregnant, I remember when I was pregnant, I was scared to death, like, oh my gosh, what if I go into labor when I'm at work and I'm away from my hospital, but the people who live in Alden and live further away are on the west side of Albert Lea that use our services, or are from Iowa that use our services. It's much, much further than 23 miles. It's 45 miles. So, also, I'll let other people talk. I'll quit talking a little
Also,
bit.
affordability, Mayo Clinic has the whole say-so about our insurance, and we're actually paying 20 to 25% more than like you guys are up here. And there's a lot of us on a fixed income. We can't afford the big prices they have. If you go out and you compare any of our medical tests, lab tests, from what we pay up here in the cities, a lot of our tests are like double.
Yeah, even a pregnancy test is double. Like, Mayo's not offering a better pregnancy test. Come on, guys.
We're getting world care, health care, so they're charging a premium for it.
Yeah.
With folks that really,
And in Freeborn County, we have the hospital now, but when that's gone, there's 55,000 people, and it will leave our whole county without an acute care hospital.
crossroads.
How many total people again? How many total people was it?
About 55,000.
And it was
And
about
that's scary. That's
400
really
births a year. And there's talk of opening up our own birthing center now, we're looking for alternatives.
And the worst part too is that they're not equipped for anything. If I was to have, a stroke or a heart attack, I would have to go to Rochester, that's an hour's drive away. I don't have an hour, Ambulance right now are having to come from Otana and pick up people in Albert Lea because there's not enough ambulances ready for them to take them to Austin or Mankato or Rochester.
That's if there is a bed. You may end up going to Austin and there's no beds. You may end up being sent to Owatonna, Mankato, and over to Rochester.
It's happened.
People have traveled around the county trying to find a bed.
Which is really scary, especially for our seniors, and especially for people who have memory issues. They think they're getting transported to Albert Lea, because we are still open now. I mean, we still have services there, and then with all these changes and everything, they're not equipped to handle us basically anywhere. Austin is full, Albert Lea is full, so you don't know where you're going to end up, and then how are you going to get home? And even when all these changes are final, and even if they do become more well equipped to handle the load, the extra load in Austin, how are those patients going to get home?
Yeah.
You know, I mean, the ambulance ride will take you there, but they're not going to take you back, and who's going to pay for that as well?
And
Yeah, we have like
our
three-
county is, excuse me, our county is federally designated as a medically underserved area and a healthcare provider shortage in that area. And so we really need some action, something to help us out of this deep hole.
In terms of action, is there any kind of bill? Do you,
Right
What are you
now,
working-
a couple of things. I know that Paul Thiessen was looking at something that would maybe help us with and connect DMC funding a little bit with it, and that's one of the things that we're kind of looking at. Like, and I think it was I should have researched this on my way up and remembered, but I think it's basically that there needs to be like they need to look and see how it's going to affect the community before they make changes like this. Another thing that we're looking at is possibility is we may be looking to get another provider in, because Mayo's not changing their mind, and they have meetings I think about every month with our city and county now, but they said from square one, we are not changing our minds. This is what's going to happen.
And they never let us know, there was no heads up on this at all.
I heard it takes 8 years to make a
With the
decision.
city or the county, they just sprung it on us at one time.
So another piece of legislation or something that we might need help with is to get with the hospital bed moratorium law, you know, if we bring in another provider so that we can get these, Mayo owns those beds right now, so we might need to get some more beds.
Our beds are in Austin right now.
Things like that. Actually, we do have, I have a list, our fearless leader had us put together some questions for you to see if you would support, kind of on that realm.
and I'm just learning, this is the
Right.
first I've heard of it, so I'm,
I just want to say what I was trying to say, just one more thing.
Sure.
We have 3 large nursing homes in our county. And we have a lot of old people, and that makes it really difficult not having a full-service hospital in Albert Lea, and it's really scary. It's scary for the families as well, because if, you know, their loved ones go into a hospital that they can't really get to, say a husband of a wife she's in a nursing home, that really makes it difficult, you know.
I've heard some young people thinking, well, maybe we shouldn't have children because we don't know where we're going to be able to deliver that child. So that's making a life decisions
And
now.
people can't sell their houses or anything.
And speaking of bills, Peggy Bennett is proposing medical facilities in underserved areas exempted from sales and property taxes bill. That's what she's kind of thinking might help the cause. Is that something that you'd be willing to support?
except for which taxes again?
Medical facilities in underserved areas exempted from sales and property taxes. So it'd be like, you know, we're an underserved area in Freeborn County.
Are the hospitals right now for-profit or non-profit? And the reason I'm asking is I work in a non-profit. A non-profit's already exempt from sales and use tax, so and that's why I'm asking the question.
Mayo is nonprofit. I don't know if we got another provider in there, if they would necessarily be a nonprofit or not. You know what I mean? We'd be looking at who we can get.
Oh.
I think
Most are
is
nonprofit.
where this is coming from. It would be my guess.
She
Good
said it'd
question.
be more encouraging for other providers to look at coming into our.
So a private company could come in, I suppose,
Yeah.
and provide services that
Okay,
way.
no, and that's why I'm asking, so used to, so much of the model in this state has been
Right.
the non-profit, and that's why I was asking the question from for-profit versus non-profit.
Hey, sir,
Yes, sir.
one thing we found out with nonprofit, Mayo is hiding under, they've got $7 billion in assets, and they're closing all these little hospitals. As a nonprofit, how can you have $7 billion in reserve? And with morality do this? I don't understand.
My question is why?
Yep, they're running it as a big business company instead of a nonprofit hospital is how we feel.
Say, Raquel, if you can take any video, you can. I got Channel 3.
Okay. One of the things that we're looking at is, first of all, so I've got an understanding, who's your state representative in the area?
Peggy Bennett.
Peggy is. Okay, that's why I was asked, because I'm assuming it was probably Peggy because she's
Yep.
carrying the bills there, but
Yeah, Peggy Bennett's our representative in the area, and then Ian Sparks is our senator.
okay. I'm open to it. I still need to learn further on the nuances back and forth, and particularly if it's a nonprofit that comes in. I know that at least on the sales tax and a lot of those things, nonprofits don't have to pay a sales tax on work that they do. Now the question is it sales tax that they would collect on things that they sell? And that's the and this is why there's nuance.
Right.
When I've been in a nonprofit that does sales, they have to collect sales tax and pass that on to the state. So that's why I'm kind of,
Right.
there's some nuances that I need to have a better understanding, because some of it would make sense to me, some of it would not make sense, particularly if you're supposed to be if it's a sales thing that they're selling to others, but if it's to help them reduce their cost on things that they're buying that they use internally, I could see where that would make sense.
Okay.
So I'm just trying to say, because there's a lot of different
Right.
nuances,
I
and
got
that's
it.
why I'm trying to tease it out here. I'm trying to get a better understanding, because some of these things do get rather complex.
And then another one, this is what I already touched on, would you support granting outright a waiver to the hospital moratorium law? So like if we did get another provider in, that we could get an exemption to the moratorium law so that we could get the beds that we need for that new entity, since Mayo's not bringing back those services and will continue to take those services away.
I'm still trying to understand why they're able to just move the beds from the one
Well,
location to the other.
they-
I know they bought it, but
Well, what they did is they tricked us and they combined Austin and Albert Lady. They bought us and they bought Austin, and then they combined them underneath the campus.
Right.
So
One
it makes them
unit.
a one unit now instead of two,
Yeah, we're
Which-
one hospital.
which we did not know was happening. They tricked us.
Our ICU went to Austin.
So now they're saying all their stuff,
And what-
they're moving all their stuff over to Austin instead because we were a campus.
well, and here's the reason I'm asking, because I know that the moratorium, I know just enough to know that it's really complicated, and that's about it. The thing that I'm wondering is if there's another easier approach in terms of saying that if hospital beds were originally assigned to a certain county, they have to stay in a certain county. That might be a better way to say, okay, you've got to do this and that, and if they don't do it, then somebody else then comes and takes. I'm just trying to think about the way.
We've looked into that a little bit and
Yeah.
kind of what we were told, but maybe you
No, and I
could
don't
look
know,
into
I'm
it.
just-
You could look into it even further, and maybe you'll find a better answer.
That'd be really good.
But we've kind of heard is because they are that one hospital, two campuses. That's how they can get by with it. That we'd be in a losing battle to say that they have to keep those beds in Freeborn County.
Again, they've made all these decisions just on their own without consulting anybody in our hospital.
And then they were tricky about it,
So,
you
yeah.
know.
But if you want to look into that further and
Yeah, we
find out.
trusted them.
That'd be great.
I can definitely will get in touch with you, send you an email and see if you hear something different, because that's kind of what we were thinking at first too, like, gosh, if we just say that they can't even move those beds out of the county. Another issue with that though, that I'm thinking would pop up is, I think that they think that they might not need all those beds, so some of those beds might not even be used. Does that make sense? Like some of those beds might be moving over to Austin, but some of those beds just might not be used and just might be owned by Mayo and not used by anyone.
Well, that's the question I
You know,
have.
that's another.
And I know where it gets complex too is I know that hospitals have try to keep some surplus beds available so that when a major incident happens, they've got the capacity to take care of that. And I know that some hospitals have like in the metro area, some of them are bumping up against that where they're almost 100% full all the time and they need more beds because if a major thing happens, they don't have the room to take them in. As you can see, I just know enough to know it's complex and why I'm moving cautiously because I know knowing the issues that I'm hearing from the other side where they need need more beds because, you know, they're parking them out in the hallway, or they're saying you gotta go to another hospital we can't take because
Aren't they-
we don't have beds.
Aren't they licensed to have just so many beds?
Right, they're licensed to have so many, and so,
Yeah,
but when
so
things happen,
change.
so when things come in, as population grows, in some areas, they start exceeding that, you know, capacity. They need to have more beds available. They aren't, you know, they're licensed for a certain amount because of the moratorium, then they have to
Right,
get exceptions to that.
Okay.
So I know there's some of that goes into it.
What bugs me is when they merged the two campuses or into one, they got, say, 1,000 in each, 1,000 people in Austin, 1,000 people in Albert Lee. They can, by law, have 1,998 people, employees in Austin. They could have, I'm exaggerating, and they could have 2 in Albert Lee, and they could put out a press release, there is no job loss.
But I'd say they can move them from one to the other.
Right,
So
and
Yeah.
they say there's no
That's
job
really-
loss, and you still have nobody in Albert Lee, but there is, according to the law, no loss. And it's gonna devastate Albert Lee.
It is.
Yeah, this is not only impacting us medically, but this is impacting us
Oh, it's gonna ripple
economically.
down.
Yeah, it's
The
our
region.
biggest employer.
I'd say it's a
Less
regional
people
effect.
employed, plus less people are going to want to come to our county and our city because it really basically will not have a real hospital. So another question, this is another one of Peggy Bennett's. Review period before a hospital services can be removed. And the bill that she's proposing is the public interest review requirements established for a hospital's discontinuance or transfer of an essential health service. So basically, Mayo just kind of sprung this. Nobody knew. They didn't talk to anybody in Albert Lee, and you know the city, the county, nobody. And then actually the nurses had found out, and then Mayo decided they better publicly tell everyone since the nurses kind of found out and was going to leak that. But there was no. No one looked into it, no one studied it. There's no upfront like, hey, how's this going to impact us medically? How is this going to impact us economically? Any of that done. The only thing I don't like, but other people have talked about these type of bills too, is I think they're good. I really do, and I hope that you would be willing to support it because it certainly won't hurt anything. It can help, and it can help other communities. Probably too far late for us, but this is happening everywhere. It's not just happening to us. It already happened to Fairmont. It's happening in other places, not just Mayo is doing this.
It's a rural
we kinda
healthcare issue.
We focus on Mayo and we're not happy with Mayo, but it's not just Mayo. But the only thing is it doesn't really have any bite to it. I don't know how anyone can make it have bite to it, but that's kind of, and other people have talked about this too, but it still would delay it, and it would still have everyone take a good look, and hopefully have the entity, the provider, plan better, because this whole SCU move was not planned well. Like we're saying, people are moved all over the place. They don't know where they're going. They're going over to Austin. Well, they're full in Austin, so then they're going to Rochester. Austin patients can't go to their SCU because it's full with some Albert Lee patients. They did not plan this well, so that would actually at least postpone things to have a better plan, even if this did happen, So would you support that?
I'm open to it, and what I realize, and here's where I'm starting is because here in the metro area it looks different than out here. Because as I sit here, I can picture 1, 2, 3 hospitals within 5 miles of here that no longer exist that have gone down. But because of the way the system is structured, it's not as much of an issue as out in the rural area where you've got greater distances. And so that would be my is trying to figure out how does this done in such a way that's making sure it's addressing the issues out there, because as the populations in that area have moved out to the suburbs, a lot of things have gone out to the suburbs because they've had to build hospitals out in the suburbs. For a long time they were not, but that's where the population was.
Right.
And so there's, and because of that, it's what I'm saying is I'm open, but I also want to make sure that we're doing it in such a way that it doesn't unintentionally cause issues here. Just like when we do things here, I want to try to make sure that we're not doing things intentionally.
Absolutely.
That how it does it place differently in the different parts of Minnesota here.
Right, and I think it'd be good for you to touch base with Peggy and kind of find out. I know that anything we've ever talked about with different legislators, we've been trying. I know that they have been trying to be mindful that it doesn't have unintended consequences where there is not a problem, like in the metro. Right, we're having this problem in rural areas. We need it to help us, but we don't want to have some unintended consequence. So I think that she would have thought that through some, but make sure that is,
And I'm knowing Peggy, she's probably done that, but because I'm just hearing about the bills for the first time now and everything else. Do you know where the bill is right now? What committee it might be in? Is it in?
I honestly don't know.
Do you even know what the bill number is?
Yes, I do.
The reason I ask is because I can.
I have that.
I can call
Jennifer was very organized.
Yes.
Oh, awesome.
Our fearless leader, HF 3288.
Okay, give me a second here to scroll up.
That's an easy number.
HF 3288.
Yeah.
Easy number to remember.
Why is that easy to remember?
3288. It's just
Oh, I thought maybe it has some special significance to
No.
Dan. Let's start making
All the
up
numbers.
reasons that has
All right.
significance for Dan.
Okay, so it's in the Health and Human Services Reform Committee right now. Do you know, has it had a hearing at all in the Senate at all, or?
I don't know. I don't think so. I don't know.
All right, and I'm just asking, trying to get a feel for things, because part of the issue that we've got going on is for bills, they need to get through one of the chambers for the first deadline, which is today.
Oh.
No, and I'm just saying, I'm trying not to, I don't want to be a wet blanket, but I also don't want us to be unrealistic as you guys are asking questions. I don't want you to raise hopes up unexpectedly and leading down the road. Because I don't know if it was being scheduled for a hearing today or the Senate. If it is, you've got it keeps on moving then, and then the second deadline is next week to be heard in the committees of both chambers to have a shot on it. I can see that it does have a couple of Republicans, a couple of really good people on that bill that would help move. So I would hope that she'd be able to get a hearing on it to get it moved through the process. And I don't know how many committees it's got to go through, et cetera. And that's why I'm kind of trying to figure out how some of these will move. Some of the bills may have already been, that you mentioned, may have already made their hearing deadlines. But it's good to find out because and I'm glad you're taking the time to come down here today and help educate.
We're from Sabre Hospital. We have an appointment with Representative Olson at 11. Good. I thought I called
Aren't you kind of surprised that there's no security?
so things going pretty smooth.
They are, thank you.
Good.
Good to see everybody down here. I love it.
They said they had it all solved.
Yeah.
Or something like that.
Yep.
Well, and this is what we need. The legislation we talked about. I was bringing up to them, I think it's another thing that's important to push is being able to cross the border with our health insurance. Because currently Medicare can, but we can't with our private insurance, and that's important so that brings
To the state building and the tunnels once again, following our signs so we don't get lost. Next, we are going to see Representative, oh, I can't see my highlights, Jeff Backer.
Did you like high fives, Polly?
Albert Lee.
Come out and get some cafeteria.
Hey, there's
Let's see. Okay, Santa.
Hey, that's a good idea, Joe.
Last of the Mohicans.
Huge. If you want to say, is it worth, all the stuff we're going through? The fact that all of us were up there walking those halls and going into those rooms, this is really significant. And I think you just got to pass on. There's some of us that are like I've been doing stuff with county and doing, you know, working this community health board and trying to get that things going, and others like Craig working on this alternative provider and communication with the city and the county and blah 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 blah. There's a lot of things going on, but it doesn't look very dramatic. It doesn't look like there's anything going on at all, but there is. And so when we go up there and do this kind of stuff, it reinforces that we are not going away, and we will have a clinic and hospital one way or another. We are going to have it. So, okay? So don't, you know, if you hear some people say, well, because we didn't necessarily make a big thing out of, you know, we haven't followed through necessarily with eminent domain, but you know, that discussion can go on, and there's a lot of us have different opinions about that, but however we get there, we'll get there. And we just have to trust that there'll be bits and pieces along the way. And the fact that we can pull together this event and get this busload to go up there, it is incredible. There is nothing like it. I mean, this is power. This is power at the grassroots level. And shout out to Jennifer, who put this stuff together. And Jean helping as well. Jean Eaton helping with the stuff and getting the booklet out and pass on to everybody, and all the people helping. Where did the donuts come from? Who got those donuts? Who? Fairmont people?
Yeah.
Well, isn't that great? Yeah. And so I hope you feel like you really made a good use of your time today, because it was really significant. And trust the process. So if you hear people out there saying, you know, well, geez, you know, you've lost your fight, you're really not into it anymore. Well, I don't think so. I don't know what it'll be, what the final result will be. I mean, there's cases, even you've seen that, where they put up a fire department, and along with that, there's a clinic. Did you see that in there? Yeah. So there's so many ways, excuse me for using the expression, there's so many ways to skin the cat. And if you like cats, no offense. So I mean, what's exciting is that we are in control of our healthcare right now, and it's all gonna work out one way or another. We just have to trust the process and trust it. And thanks to the bus driver doing a great job. Let's give him a hand. And it's really and Dan with all his picture taking and all that kind of stuff.
Some of them are in focus today.
Yeah, so some of them are in focus. So anyway, it was all of our legislators were just great. They were really impressed. Angie, you were saying that there was one or two that didn't have a clue.
There was one. Yep. We went to, I think it was really apparent to our group, like, wow. It was awesome.
Yeah, wow, they were saying they had no idea. So they've got, a lot of them got education. Some were really on top of it. They really knew what was going on. So just pass it around that we're not done. You know, if you just stand here and look at all you guys, I mean, we're not going anywhere. You know, we are Albert Leans, and we are claiming our destiny. And I think Mayo thought we would just lie down and die. Well, got a different story for him. Not going to happen. So, congratulations to everybody. It's great.